Good afternoon, and welcome to the B. Thomas Golisano College of Computing and Information Sciences. My name is Andrew Sears. I'm the Dean of the college, and this is the Dean's Lecture Series. The series was started about 10 years ago, and it was designed to bring people from industry and academia to campus to share their thoughts and insights with our students, our faculty, and members of the community. And today is the last of our lectures this year, the 47th overall over the 10-year span. At this time, I'd just like to check, do we have anybody in the room that needs an interpreter? In that case, our interpreter can... Okay, great. Well, I'd like to thank our interpreter, Jennifer Jess, for her services today. And Rick, can you join me in thanking her for our services? So. Okay, so we got that set up. Okay, so now it's my pleasure to introduce our speaker for the day, Mary Czerwinski. I was just sitting there thinking of when we first met, and I think it might actually be in the category of where I don't really want to figure out how many years ago it was, but it's been a while. Well, we won't count the years. So Mary is an ACM Distinguished Scientist, and her research spans a variety of areas, including emotion tracking, information worker task management, and a number of other topics over the years. And her PhD is in cognitive psychology from the University of Indiana University, Bloomington. I'll get it eventually. But today, now I'll read from the script, so I will get it right. She's going to be talking about emotion tracking for memory, health, and awareness. And we'll be discussing a novel system that she and her team developed at Microsoft. So without further delay, I'll turn it over to Mary, and please give her a nice, warm RIT welcome.
Okay, let's just see if I can get this back on. Hi, it's a pleasure to be here. Thank you, Andrew, for that warm welcome. We met in the early 90s, and Andrew was a graduate student doing his dissertation with Ben Schneiderman, so yeah, I remember that well. It's great to be here. I got to see snow. I felt like doing snow angels. I was so excited. I hadn't seen snow all year, so thank you for that as well. Can someone turn on the screen, please? Or do I have to do it again? Okay. All right, great. So obviously, this is what I'm going to be talking about today. I have a whole host of colleagues. My team is very multidisciplinarian. We have everyone from designers to interns to machine learning specialists to hardware engineers working on these projects. So in all cases, they did the lion's share of the work, not me. What I'd like to do today is I'll set forward the agenda. I'll talk to you about why we're motivated to look at this problem area. We do try to pick problems that are human motivated. We don't just do technology for technology's sake, so that's something that sets our group apart in some ways. I'll talk about the first system we built, which was Affect-Aura, and that was presented at CHI 2012. And then I'll move on to some work that's actually all still in progress for the most part. And these are really just beginning forays into this field of motion tracking for health and well-being. I think we have a lot to learn as a community, and I'm super psyched to hear that you've got folks here that are interested in this topic as well. So hopefully we can all learn from each other as we make mistakes, but also have some successes. So why are we interested in this space? Well, the market for wearables is just exploding. How many of you here wear a Fitbit? Okay, one. Oh, this is the most unusual audience I've spoken to, 3, okay. Well, Fitbit is a little tracker. I've got one on today. It counts your steps, your calories. It looks at your sleep quality, stuff like that. And since the Fitbit came out, the body media actually in the lower right-hand corner for you guys was actually the first. But since these 2 devices have come out, there have been a myriad of them on the scenes, and most of them are now bands. Even the Fitbit now has a band version. Pretty wearable, pretty comfortable, not too geeky. Some of them are kind of geeky. The Fitbit people pretty much hide. So this shine one is the one I like the best. You can make it look like a button or a necklace. It's really cool. So they all kind of do the same thing. They're all looking at, they have accelerometers, and they're looking at the distance you travel and then calculating how many calories you burn. And people are very, very enthusiastic about these things. There's a whole community around them. Apparently, Fitbit is one of the hottest selling items on Amazon. And it's got a social network associated with it. So people are starting to get into this quantified self movement. And we're going to take that to another level. So basically, we believe that true health has to include emotional health. So, you know, the things I showed on the last slide, those are all about health and fitness. But we don't think you can truly be fit unless you're also emotionally fit. And understanding your emotional habits is actually key to living a healthier lifestyle, meaning you reduce your stress levels, your obesity levels, which are directly correlated with stress levels, et cetera. So beyond fitness, we believe there's emotional fitness. And I actually thought when we started this a couple of years ago that there wouldn't be a lot of product transfer. In fact, I thought it was pretty risky because it's not tied to Microsoft's goals in any way. Well, come to find out, product teams are extremely interested in this topic. And if you think about it today, isn't it kind of silly that your computing devices don't know anything about your mood or when you get frustrated or when you need to be cheered up? Things like that. So now that we can do it, there's a ton of product interest in this. And you know, for those of you doing game design, just think, you know, if you could see your users' faces while they were playing the games or hear their voices and kind of gauge their excitement levels, it would even help you iterate your designs, right? So we decided to first focus on stress and anxiety because I think everyone can realize that this is a pretty big problem for our society. So we figured we'd tackle the biggest one first. You know, 51% of obese people eat too much because of stress. I actually have our own data that kind of supports that. We didn't get that high a number, but we got a pretty high number. You get a 3 times increase in hypertension and 2.2 times increase in cardiovascular mortality in high-stress jobs. That's pretty bad. So I told people earlier, I always make the joke, I read so much about stress now, it totally stresses me out. And it's true. I can feel now, because I'm so aware of it, I can feel my stress, and it scares me because it's so bad for you. And here's the thing. You know, how many of you think you know how to handle your stress level well? Some people do. I mean, you can see that number, though. Most people don't feel like they do. You know, and I used to have a slide that showed people drinking and people doing yoga and people working out. I mean, they have their way, people have their ways of handling stress, but not all of it's healthy. And we had some literature that showed, there was a company called Staywell Corporation in the UK, and they did a really big study looking at 46,000 employees, companies like Microsoft. And what they found, controlling for all kinds of things like smoking, alcohol use, et cetera, they found that stress was actually the most costly health risk, you know, even beyond alcoholism, high blood pressure, stuff like that. And the thing is, when your brain perceives stress, you release chemicals to your body. It's called the fight or flight syndrome. And basically, it's a flush of adrenaline, noradrenaline, and cortisol. And what this does is it immediately increases your cholesterol levels. And there does seem to be, although it's not super well understood, a connection between cholesterol and cancers, heart disease, because it's kind of like an inflammatory effect on your body. And so the other thing that's really bad about chronic stress is that it actually gets in the way of you making healthy decisions about your life. So how often is it when you're stressed and you're in a rush, you just grab for junk food to eat because you're hungry? And it's because you're actually thinking out of the dinosaur part of your brain, not the, you know, the frontal cortex like you should for good decision making. And actually now studies have shown that when you meditate, do yoga, practice mindfulness kinds of practices, you actually can move out of that part of your brain into the smarter areas for making decision makings, for making good decisions. So that's a really interesting thing. So our hope was that we could somehow use technology to intervene when we detected these kinds of stress situations, especially in chronic stress situations, and maybe intervene to help the user get out of that mode, out of fight or flight, and into something more mindful, and hopefully something healthy. So I just said that. Okay, so what this brings us to is the field of effective computing. How many people know what effective computing is? Okay, a few of you. So Roz Picard started this field in 1990. She first published a book called Effective Computing, and that coined the term. And basically, it's a bunch of computer scientists and psychologists and others who like to look at things like facial muscles, the prosody of your speech, perhaps what you're typing or saying. There are many, many people who are looking at Twitter now, for instance, to detect moods. And then they use machine learning to do classification of these signals, these various physiological signals. And we've gotten really good at it. Like the machine learning parts that I'll talk about today, those aren't even interesting or patentable. They're just off the shelf these days. In fact, there are whole libraries of them free for use out there. What's innovative about what we're trying to do is actually on the intervention side. That's where the human-computer interaction part comes in. So all the stuff I'll talk about today from the effective computing side is pretty de rigueur. So how do we get ground truth? Well, in this effective computing field, there's a model, the circumplex model, which is very well appreciated and well used. I don't actually think, and I could give a whole talk about why I don't think this is the best model, and we have some evidence that does support it to some degree, but shows there's another dimension in there, and we don't really know what it is. But basically, this model is you have your valence on the x-axis, and it goes from negative to positive, and you have your arousal levels on the y-axis, and it goes from low to high. And basically, what you ask users to do is put themselves in that 2x2. How many people think you could put yourself where your mood is right now in this 2x2 model? Knowing what I just said, negative to positive, low to high arousal. You're all in the upper right hand, right? Because you're listening to my talk. But I think what I was trying to point out is if you just immediately tried to feel how you're feeling right now, it's not easy, right? We're not used to reflecting on our emotional state. And I've got some funny anecdotes about that, actually, when I start talking about the studies we did. But this is what ground truth is. We ask users to tell us where they are in this 2x2 model. So the first system we built, which I was talking about earlier, we presented at CHI 2012. And I don't have it running on my laptop, so I'm going to show you a video. And I think you'll probably understand how it works. But our goal here was to build a system that actually helped you remember how you felt day by day in the past. So it's not a real-time system, it's a reflective tool. And we built this system because we did a survey at Microsoft asking people if they could remember how they felt 24 hours ago, if they could remember how they felt 48 hours ago, if they could remember how they felt a week ago, a month ago. And what we saw was there was a rapid decline. People felt like they could remember how they felt yesterday, but not the day before yesterday. So super rapid decline. And they could remember pretty well what they were doing, but not how they felt. So then we also asked on the survey if people wanted technology to help them remember how they felt. And they definitely said they did. And then we got lots of interesting write-in comments at the end. This was an N of about 300 at Microsoft. There were a lot of people on medication. And they might have self-selected to take the survey, in fact. We don't know. But they said, you know, they take medication, and they can't tell their doctor if it actually is working or not. Is the dosage right? So we were pretty motivated to try to do something to help them. So let me just show you what this system was like. Presuming it...
We present Affectora, a visualization of a user's emotional states over time for reflective purposes. How well do you think you remember your mood over time? We have found that people's moods are quite volatile and can change rapidly during the course of a day, and that users tend to forget these mood swings pretty rapidly. We developed Affectora to visually assist users in keeping track of their emotions over time. We combine multiple streams of sensor data in order to capture the user's context and model their emotional state. Let's explain. Affectora lays the day out on a timeline, including where the user is, which we obtained through GPS. Locations are shown as icons on the timeline. The balloony shape colors indicate hourly mood patterns, positive in pink tones and negative in blue tones. The size of the balloons indicates the user's activity levels, and we show the kinds of documents and websites the user is visiting at that time. Smooth balloon shapes suggest that the user is less engaged in the activity, while bursty shapes indicate high levels of engagement with the activity at hand. The user can flip through days by using the navigation arrows to either side of the timeline. Let's take a look at Joe's Affectora. On Monday, Joe starts the day out on a low or negative tone. But then, as he becomes more active, he becomes more engaged in the work he's doing, and his mood picks up. By the time he leaves the office, in fact, he's in a better mood. Let's compare that to his day on Tuesday. Tuesday starts out extremely busy, and he seems happy as he works. However, after lunch, it appears as though Joe is working very hard, but his mood has soured. Affectora allows Joe to take a look at what happened to trigger this mood swing. Looking over his day, we can see that at about 1 p.m., it appears as though Joe received a nasty email from a colleague. This must have triggered a negative mood swing that seems to have impacted the rest of his day. Affectora can be used to go back in time and reflect on what patterns of behavior lead to happy or sad outcomes. A user study showed that users found Affectora to be useful for reflecting on and remembering mood swings over time and what triggered them. For future directions, we intend to go mobile and wearable in real time. We'd like to use fewer sensor streams, but we think we need to add heart rate. Application areas include detecting emotional states like happiness, stress, anxiety, frustration, and depression. And we'd like to leverage fabric and social media as outputs for these mood detections. I think we can all agree that emotions provide the spice of life. But how well do you think you remember your emotional mood swings over time?
Okay, so Affectora was literally the first automatic prosthetic for mood. It had never been done before. And I don't know if you saw, but we used a Connect for lean in, for posture, lean in and back. We used GPS. We used everything you did on your computer. We used just a regular webcam for facial changes. We used speech prosody detection, so you can tell from the prosody of one's speech whether or not they're stressed out or not. I think that was, oh, and we had an Affectiva Q sensor on them, which is collecting their EDA, their electrodermal activity, basically how sweaty they were, which can give you signs of arousal. So when you put all those things together, and we think this is the reason Affectora was so accurate, which it was about 70% accurate, you actually bump up the chances of accurately classifying someone's mood. So Ashish Kapoor, the guy that was with me, was from Roz Picard's lab, and he said this is the best he's ever seen in terms of affect recognition or classification. And users really liked it. We did track them for a week. We didn't show them their Affectoras. We just collected surveys at the beginning and the end of the day and just logged them. They were wearing all the sensors. And obviously, the Connect information was missing when they went away from their desktop because we didn't have the webcam and the Connect cameras. So we were missing data for some parts of the day. But overall, we were able to pretty accurately classify their moods. As I was telling people last night at dinner, for really big emotional events, it's called the von Restorff effect, users have excellent memory for things like that. What this was really good for was for those little microcurrents throughout your day. Users would look at it, we showed it to them on Friday night when they were done with the week, and they'd say, oh, I always seem depressed when I go to that meeting, or that person always really bums me out, and they would say, these are behavioral decisions I make to go to this meeting or to be with this person, and I don't have to do that, So it was the little things in life that make them happy or made them sad that they really appreciated being reminded of. And I do think it's cool to be reminded of the happy things in your life. If you're kind of a depressive person, that could actually help you. Maybe classify your own mental state a little bit better. People and email and calendar events were by far and away the best cues for recall. So we would show them what their mood was, but they had to go back and figure out why, right? And those three cues were clearly the best. The file logging details actually really didn't help very many people at all. So we could probably get rid of that one. And also people recognized that Affectora was really helpful right now, but it'd be even way more helpful later, 3 months from now or something like that. I do want to say that there's some danger here, if you haven't already figured it out, that we would insert a false memory. So if I show you you are happy at 3 o'clock, but that didn't actually happen, the machine classified it incorrectly, that might be disturbing. That disturbs me that we could do that. So I think you would want to make a system like this extremely interactive with the user so the user could correct it, and maybe it could get better and better as it went. That would be the idea anyway. Any questions about Affectora? Yes?
I wonder about why people would want to remember what they were feeling historically.
Well, it was actually motivated by a woman in my group who came home from work one week on a Friday night and said to her husband, oh, it's been such a horrible week. And he looked at her and he said, why? He goes, you got a best paper award at Chi and you got a promotion? And she went, oh yeah. You know, people forget. And they might be misclassifying their own mood states. Depressive people actually have a depressive lens on the world. And it might be really useful to remind them that things aren't so bad. The other motivation we had behind this, other than helping people with their medications and stuff like that, was actually to index our lives emotionally. So if I am in a bad mood, I say to the system, show me everything that makes me happy. And the system can proffer up a bunch of wonderful events that I can look at, and it might put me in a good mood. It's just another way of indexing information, and it might allow us to do very contextually relevant things. So that's kind of the motivation. Yes?
On average, how much computing power would you say was required per user, like instantaneously? And is there potential with that number to integrate it into something as compact as a smartphone?
Yes, so let me keep talking. But yes, it does require a lot of computing, but you actually have to be smart about where you do that computing. Some of it can be done on a smartphone, some of it can be done in the cloud, right? Okay, let's move on. Okay, so that was Affectora. We were super motivated by that, but last summer I had 4 excellent interns come in, and we wanted to go well, not wireless, but we wanted to go, wireless, and we wanted to do this in real time. And this woman, Erin Carroll, was very motivated because she called herself an emotional eater. She was very motivated to work on this emotional eating problem. Now, this was an extremely difficult problem because not only does she have to come up with a system that could automatically detect moments when you might reach for that donut, but she also has to learn about emotions that are associated with emotional eating and then pick a good intervention. And the science around interventions actually is very nascent. So there was a lot of work to be done there too. So obviously she wasn't able to do all that in 3 months, but I'll tell you what she did get done, and this work is still ongoing. So first she did a Mechanical Turk survey of about 300 people, or maybe it was 600 people. I should have written that down. And 36% of them said they're emotional eaters. So you saw a number earlier, 51% of the obese people eat for stress reasons. We got emotional eating responsive about 36%. And 82% of those people said they would love technology to help them. And this is true of every emotional eater I meet, actually. I haven't ever heard anyone say they wouldn't want technology that could help them. So we've run a lot of participants in these studies now, and that seems to be pretty universal. So her approach was, she was going to investigate eating behaviors in order to understand when you need to intervene. And then she was going to look at intervention types, which that part really didn't get done. And then she was going to develop technology for implicit emotion detection so that you could intervene at the right times. Pretty ambitious. So what we developed was this smartphone application called EmoTree. I like that name. And EmoTree has leaves on the tree for days of the week that you've been running the software. Every day you get a new leaf. The greener the leaf is, the healthier you ate. The bigger the leaf is, the more you ate. So we made, and these 3 little birds are supposed to be 3 people from your social network who you've asked and they've agreed to opt in to help intervene if you want a social intervention. And we kind of give you, here you are, you're happy. Overall is your happy mood today, okay? So for this point in time, this person's pretty happy. And what we did to collect ground truth data was we gave them the 2x2 circumplex model, as we've discussed. And basically, the circle started in the middle, and they just had to drag it to the place where they thought they currently were. And we had 12 participants, 2 males, because there are male emotional eaters, believe it or not. And what they had to fill out was a pretty simple diary. So they just had to say what time it was. So we assumed it was the current time, but they might go in and put it in after the fact so they could fix that. And then they said, was it healthy or unhealthy? Was it too much, too little, or just right? And were they hungry when they ate? Somewhat, very, not at all, stuffed. Then they hit submit. We also asked them in the circumplex model, we asked them how engaged they were with what they were doing right now. Because sometimes you're super engaged in a task and you eat for emotional reasons, but you're actually like not stressed or in a negative mood. What we found across these 12 people was that there were lots of individual differences. They were very good about entering their mood when we experience sampled, so that was good. They were pretty good about entering their food as well. 6 out of 12 participants were predominantly stressed when they ate. So that's where they were self-rating when they actually ate. They were saying they were stressed out. Very little eating occurred in the serene, calm area. There was eating in the happy area. So this is one participant. The small dots are her emotion ratings throughout the day, and the large dots are the emotion ratings associated with eating. And you could see the large dots are predominantly on the negative side of the chart. So whether or not it's stressed or just depressed and bored, that seems to be where this person is eating. She was pretty representative. There were people who ate when they're happy. You can see this person did too, a couple times, or at least neutral. We didn't ask, are you with anybody? And I think we should have, because that might be when happy eating occurs. It's just a thought. So in our next study, we're going to ask. And so since we saw that, and we hadn't built the intelligence system yet, because we didn't know if this was going to work, we didn't want to go build the whole system out, we actually ran a second part of the study with these same 12 participants, where we just chose to intervene if they self-rated in this upper negative quadrant. This is the stressed quadrant, stressed, angry. So they didn't know it. It wasn't an actual automatic system. We were actually using their self-ratings. But interestingly enough, there was a significant enough delay between going up into the cloud and coming back that they didn't actually discover that the system was just using their self-ratings. They thought maybe they were using, because I'll tell you in a minute, we had sensors on them. So ironically, they didn't know this wasn't the system. And what our intervention was a little bird comes in and says, let's count to 10 and breathe slowly. And so you have to tap the screen 10 times, and you're supposed to breathe slowly. Now, we don't know. I mean, they could only go so fast, and they couldn't get rid of the screen, but we don't know if they were doing the deep breathing. But 3 of the women said, it was all women, said that it was such a good technique for them that they actually incorporated it into other parts of their lives. So that was great. Other people wanted things like games. They wanted a reminder to go take a walk, a reminder to eat something healthy. Some people said they wanted their social network intervened, which we could have done but didn't do. And so we have a study starting actually as soon as I get back, where we are now going to provide them with a menu. We've actually got the automatic detection working. And we're going to provide them with a menu when we just in time intervene. And they can pick one of any of these things, including the social network. And then we'll see what the relative efficacy of any of those options are. Okay, so we had them wearing sensors, I said. So we had this crazy idea that we could build sensors into underwear. And so we got a custom board made down in the hardware lab. That's the little thing in the middle of the bra there. And this worked really, really well for women because we put conductive fabric in the sides of the bra because we wanted to get heart rate and heart rate variability, because heart rate variability is a very good indicator of stress and depression. So it's when your heart rate variability goes down that's bad. So it means the intervals between the beats, when that goes down, when it becomes really tight and steady, that means you're in stress mode. That means fight or flight has kicked in. If it's all variable and all over the place, those intervals, that means you're actually happy or not stressed or calm. So we built these things into the bras. We had the women wear them the whole time we were running this study. Even the men, we tried to build it into their underwear, but unfortunately for boxers, it's too far away from the heart. We got a really crappy signal off them for that. So we got to think of something better, or they have to wear bras, one or the other. We haven't decided. But it was kind of funny to have these being made out in the design lab. You wouldn't believe how many men wanted to join our project. And this is what it kind of looked like. The custom board was in the middle. We collected EDA on the bottom of the breast, and then EKG from the side, as I said. And there's another view of it. So we got EKG, galvanic skin response, movement through the accelerometers and the gyroscopes, and then we had the conductive soft sensor pads. This is another view, 3 pads, and this is how she kind of wired everything up. This was the designer kind of doing some fashion. And she even used Scotch tape, so a little bit of everything. So as I say, this study's gonna start next week, where we actually get to look at which intervention. We can have them personalize the interventions to their liking. We have even a bigger study that's motivated by this one that we're gonna do with hundreds of people over the course of a month looking at interventions, because we don't believe a little study like this with a small number of participants doing automatic detection of your mood is going to be enough to know what we should be doing with the interventions. We think we need hundreds of people of all different kinds of personality types for a very long period of time to look at the context they're in. Because if the system detected that I'm nervous right now, do I want an intervention coming in because of where I am? No, absolutely not. Maybe it could tap me and tell me to calm down, but the kind of intervention is really going to vary based on where the user is and what context they're in and maybe who they are. So we do have the automatic detection working now. That we did get the machine learning done on that. That's all working great. It's pretty reliable. Now we just need to do the user studies and look at the intervention classes to see if we can come up with good policies for what kinds of interventions to deliver when. So any questions about that? Yes?
I'm just wondering, like with the food diary, like is it intended like whenever the user eats or just for like snacks and stuff? Because I could imagine that like the data can be construed like if you filled it out like when you eat dinner. Like if you eat dinner at a specific time,
Right.
like regardless of whatever mood you're in, like that would influence like when you would need an intervention.
Yes. Well, obviously the time of day will be something we'll be looking at as we collect this data, because we have a feeling that late at night is when we're going to see the emotional eating, but not always, so sometimes during the day. My guess is it's not around a meal, or it could be around a skipped meal. So that's what we're presuming we're going to see. We don't know right now. We didn't ask enough information in the first study about who they were with, why they ate the way they did. So we're going to have to ask a few more questions to get at that kind of issue. Yeah. All the users in our study, this is the problem with doing studies in the wild, right? All the users in our study said they ate better because they knew we were monitoring them. So there is that effect, that effect of being observed. That does kind of ruin your data, but we're hoping that with longer periods of time, we're going to see more realistic behaviors and probably realistic rejections of some of these interventions we come up with. Yes?
Did you ever have a case where one of the subjects reported that your monitoring mechanism actually contributed to their stress?
No, but I think that all the time. So we just did a 35-person study in Building 99 where all of MSR is. And we were basically experience sampling them every 15 minutes. It was random, but it was pretty much that often. And I know for a fact we made them more stressed out. The only thing that made it better is we paid them $250. So they actually usually replied. Yes?
It's hard to see the circle. So the food diary, is it only, solid foods, or do you record liquid intake?
So we made it as brain dead as possible. We could have asked them to minutely enter every single ingredient and whatnot, like some of these food diaries do. They're very tedious. And we knew, I didn't even tell you the funny story about these bras. We knew these women were already basically laying themselves on a knife for us, right? Because those bras, you had to take them off every 4 hours and charge the batteries. So they would wear them from 8 to noon, take them off, run to the bathroom with their other bra, take them off, plug them in, and then after lunch they'd put them back on, and then before dinner they'd take them off, plug in the batteries. So they were working so hard for us that we made the diary part of it like so simple. But we could have plugged into some of the software that's out there, like for the Fitbit and stuff, that gets more particular about what it is you ate.
Because I would think nowadays, we emphasize on hydration, whether it's water, or more importantly, the 5-hour energy drink.
Oh, yeah. Yeah. Hydroxycut, all that stuff. Yeah. And maybe level of protein in what you ate, stuff like that. Yeah, we could get really, yeah. Well, what's interesting? One of my friends coaches senior executives at Microsoft, and just to get to this point, she's telling them what stress is doing to their bodies, and they all want to lose weight, so they all want my app. And they are so busy, like to fill out a little thing, there's just no way. But maybe filling out something like a hydration level, maybe something little like that could still be doable. It's a good idea. Thank you for your suggestion. Okay, so let's talk about the second application. This one I really love. This is near and dear to my heart. About 3 years ago, we built a system called Honest Signals. And the idea of this system was, it was built into Skype, and it was to look at you when you were in a video conference call with someone else, is to look at your face and your speech prosody, and your movement, and your nodding, and your smiling, and it was supposed to say, and how much you're talking, it's supposed to give you feedback about how you're doing in that conference call. And the other person is also getting feedback about how they're doing in that conference call. And so when we built it, I really loved it because, you know, in a high-tech culture, it's like dog eat dog and you know, Microsoft people can be like, and the first thing that happened was I started putting Microsofties in front of these things and, you know, gave them a task, like convince the other person of X. And they would look at the signals and they'd say things like, oh, I see I've been talking 75% of the time. I should let you talk. And I was like, oh my God, you know, it worked. So they saw these signals about how agreeable they were being, how in charge of the conversation they were, how much time they spent talking, how much they were talking over the other person, which was very interesting feedback. And so we tested this, and people thought it was interesting. They weren't really sure what to do with it, but they actually liked it for going back after the conversation to see how they did. Some people said, oh, it'd be great for practicing job talks and stuff like that. Or for looking at salary negotiations, how did I do, that kind of thing. And it was born from a guy at MIT, Sandy Pentland, who said he was using sociometers, these badges that people would wear. He could predict in a dorm, if everybody was wearing them, he could predict 97% accurately who was going to date whom. And he could predict with 90% accuracy if you would get the job when you were in an interview. So we thought, wow, can you build that into video conferencing? And we did, and that was 3 years ago. Then when I was giving a talk at University of Washington, and there's this woman, Wanda Pratt, who is in the eye school, and she does medical informatics. And she came up to me after my talk, and she said, that honest signal stuff, have you thought about doing it with doctors? And I said, no, it never occurred to me. And she goes, well, doctors, you know, it's really hard to train them in medical school to be empathetic, or empathic, as they call it. And the clinical empathy is actually associated with more positive patient outcomes. So they adhere to their medicine better, they just feel better overall, they trust their doctor more, they have less anxiety. They actually have fewer complications when their doctor is empathic. So she had the idea that we could do this. And it's very, very hard to train in medical school, and it's very hard to measure. So basically what they do is they get human coders who are really, really good at coding for these signals, and they stand there and they watch like a half of your session with a patient in the clinic, and they make their measurements, all via paper pencil, and then at the end of that session, you get feedback about how empathic you are. That's it. That's what you get in medical school. So given all that, and given how expensive doctors' time is, oh, and the other thing that they get to measure empathy is self-report, both of the physicians but also of the patients. So we were thinking, what if we could do it automatically? And we could give them feedback either in real time or like Affector, we could actually do it as a reflective tool, either one of those. So before, I was telling some of the students this at lunchtime, how many people know what the Wizard of Oz technique is? You do. So we call it the WOZ technique. So it's when you build a system, you build a user interface, but there's no architecture underneath it. There's no system really running it. In fact, it's just someone behind a curtain moving the dials. So the user of the system thinks that it's working intelligently, but it's actually just someone faking it behind the mirror. Okay, so that's what we decided to do with this, because to build this system was actually going to be quite difficult. It was a lot of machine learning and a lot of features that we had to process. So that's what Rupa did. We took the honest signals theory, which we proved worked, and we tried to map it to something they were using in the clinical empathy world. And they also have a 2x2 model called the interpersonal circumplex, and that looks at affiliation and control. So affiliation can basically be described as how warm or cold you're being to the patient, and control means, are you being really dominant? Are you talking all the time, really loudly, leaning over them like that in a glaring kind of way? Or are you sitting back and letting them do all the talking and just being submissive? So those were the two dimensions we needed to code for. So Rupa basically was sitting behind a one-way mirror back here. We brought in 16 healthcare professionals, and we can do that at Microsoft because we have a recruiting team that has a database of like 1 million people who volunteered to come in for studies at Microsoft. And we can screen on all kinds of attributes. We actually got some doctors, we got some emergency technicians, we got nurses, so we got a bunch of healthcare professionals. And what they do in medical school is kind of interesting. They hire seasoned actors and actresses who are trained to do clinical acting. And so they're trained to be patients, basically. And we gave her a story from out of the medical community that one of these situations for training doctors would have actually been used, a scenario. She was actually she was supposed to be very, very sick and in a very low socioeconomical class. So she had all these problems, her car breaking down, she didn't have heat, stuff like that. So very sick. And the idea here was the healthcare professional was supposed to mentor her. So they weren't, trying to be a doctor per se, but they were supposed to be very empathetic, right? And so we did this, and behind the mirror, Rupa's moving the software. Okay, she's moving the user interface. And the healthcare professional is told, here's the display that shows them whether or not they're being empathic, and I'll describe that in a minute. But the healthcare professional is told, you can look at the display if you want to. It'll give you feedback, but if you don't want to, don't, and let us know how that goes. So the first UI design is kind of weird. Our first attempt, let me show it to you.
Study showed control and affiliation dimensions in the form of a sun, moon, and a seesaw. The sun-moon graphic became smaller and more blue as the health professional's cues became more distant. This sun-moon graphic became larger and yellower as the individual became warmer. Meanwhile, the control dimension was represented by the seesaw at the bottom. The seesaw tilted towards the U label when the health professional's cues were dominant. The seesaw then would tilt towards Alicia, the Confederate actor's name, when the health professional was becoming more submissive. In the end, the large warm sun and the balanced seesaw represented a highly warm and empathic state.
Okay, so that was the first effort. We actually brought these healthcare professionals in and asked them to rate that display. And while they did say that it was helpful and informative, she didn't label this axis, but this is a number of, this is a scale of not at all to very. They did say it was helpful, informative, and even interesting, but you can see it was also confusing and distracting. So that was not our design goal, to be that. So we went to a new design, and I see I'm running out of time, so I'm actually going to just jump to videos at this point and finish up real quick.
Here we see the lotus visualization sped up to be 6 times faster. In the initial lotus visualization, each new petal emerges from the base of the lotus, representing the last minute of time. The range of affiliation varies along a 5-point blue-gray gradient. The lightest gray is the lowest level of affiliation, while bright blue is an indicator of warmth. Control is represented by the size of the petal. When the petal is larger on one side, that person is more dominant in that minute. When the petals are even sized, the conversation is balanced.
Okay, and then I'm going to show you our last design because the healthcare professionals told us that blue coloring was wrong, as you can imagine.
The final visualization we showed users was an iteration on the lotus. Again, this video is sped up to be 6 times faster. We decided to use 2 obvious colors at either end of the affiliation spectrum. Bright blue represented distance, while bright orange represented warmth, while muted versions of those colors were in between, and gray was the neutral center.
Okay, so that design they actually liked a lot, and of the 16 healthcare professionals, only 15 of the 16 said that they would actually use it in a clinical setting. One healthcare professional, he was a doctor, actually told us, oh, well, I look at the clock all the time anyway, so you could put it at the back of the clock, which I thought was kind of, anyway. We've done a couple other things. I want to wrap up here. We've done some things in this area that have been kind of whimsical, some things that we've tried to be useful, but we've tried to have external actuated based on your emotion devices. And I'm just going to show you a couple videos. Hopefully this one will work, but I'm having trouble with the embedded ones, yeah. I'm going to show you just 2 examples of this other kind of work. So the first one's mood wings.
How accurate are we at recognizing when we are stressed? Does knowing that we are stressed help us calm down faster? If someone told us that we were starting to feel stressed, could we use that information to deflect or prevent an acute stress episode? We present Mood Wings, a real-time biofeedback system in which a wearable butterfly responds to user stress states through wing actuation. Driving is a common but often stressful task that most people engage in daily. We thought that providing users with mood wings in a simulated driving environment would help them manage their stress levels more effectively. While users drove significantly more safely with mood wings, they experienced higher stress levels, physiologically and self-perceived. Despite this, users were enthusiastic about mood wings, expressing several alternative contexts in which they would find it useful.
Okay, so Moodwings was interesting. We put them in kind of a funny situation. So we made the driving simulator harder and harder and harder and harder, to the point where as they went, people were walking out in front of you while you drove, trucks were slamming on their brakes in front of you. It was really bad. So we never actually gave users a time to relax by using the wings. And the wings just kept flapping harder and harder and harder, which really stressed them out, and they were already stressed out. So they told us, you know, yes, I was aware of my stress levels. Yes, that really reminded me I was stressed out. You know, please don't do that anymore. But believe it or not, they actually drove better. So we're doing studies now looking at, we have a dragonfly now and a couple other things, looking at can we use it to calm the user down? And that's what I'm going to leave you with, the last piece. This was a piece of art that was meant to try to calm you down after it got angry. So this was done by an architect intern. She actually sewed this thing herself. We would never use heat-induced nitinol wire again, and I'll tell you why in a minute. So this is the fabric getting angry, stressed. Can you tell it's squishing? It's very slow. And now it's going to relax. Okay, she didn't show the relaxed part. Okay. I'm going to stop it there, but I will tell you the story. The user study was very funny. So, you know, what we did was we had users sit down, and for 5 minutes they had to write about a very recent but very stress-inducing event. And so all they did was write. They were supposed to remember how they felt, what they were wearing, who was with them, what the daytime was, everything they could remember to get back in that mood. And then they self-rated themselves using the circumplex model, and they were all in the upper left quadrant, every single one of them. It worked. And then we had them turn around, and they got to see the fabric get really nasty and bunched. And it was really funny because that nitinol wire gets really hot. So you had to turn on a huge fan or it would have exploded in the lab, right? And so it not only gets like tight and taut, but actually it gets really loud. And then Austin decided to shine down some red light, so it looked angry. And they're sitting there like, and they're already completely stressed out. And then we relaxed it for 180 seconds. And then they all self-rated again. They were all moved to the right, so they could calm down by watching the fabric. So we believe that these actuated devices actually could be used to calm you down when you're in a stressful state. And we're going to continue to work on that to see what really works as an intervention for users, whether it's something you wear on your, like a ring or whatever it could be. So next time you hear me come talk, I will have hopefully lots of interventions that actually work. Thank you very much for your attention.
Did anyone have any questions for Dr. Czerwinski?
Yes.
Check.
Yep.
Hi. If we're interested in learning more about this, do you have a research blog or any papers that we could look up?
Sure, absolutely. In fact, most of them are under review right now. That's how recent this work is. So we're submitting a bunch to effective computing, pervasive health, creativity, and cognition. So we'll find out very shortly if this paper get in. And as soon as they do, I'll have them on our website for sure. And the videos as well. Thank you. You were good about asking questions as we went. Yes?
I have a question about the design for the biofeedback.
Mm-hmm.
Do I really need to hold it? Then I don't want it. I'll ask you later.
Okay. Anybody else? Well, thanks a lot for your attention. Great questions all along. Really appreciate it.